Today on Tasty and Meatless, we're honored to have Dr. Caldwell Esselstyn, Jr., who's a renowned individual and physician from the Cleveland Clinic and also a pioneer in heart disease reversal research. Nice to have you here.
John, I'm proud and delighted to be here.
Heart disease is the #1 killer in America today. Tell us about that.
That's unquestionably the case, and what we have to do is define the fact that we've really got to focus on eliminating this #1 disease. For instance, we have over 500,000 people who will die this year of heart disease. There will be another 1.5 million people who will have a diagnosis of a new heart attack. There'll be another 3 million people who will have a so-called silent heart attack. They'll have severe indigestion, and this will be when their heart attack has occurred. But, you know, the exciting thing is the lesson that we learned really from World War II. When the Axis powers of Germany overran the Low Countries of Holland and Belgium and occupied Norway, they actually took away a lot of their livestock, their chickens, their goats, their lamb, their sheep. And these countries were largely subsisting on a plant-based diet of grains, legumes, lentils, vegetables, and fruit. And there was a documentation in Norway of how their deaths from cardiovascular disease, from stroke and heart attack, during a time of greatest personal stress, when their country was occupied by the Axis powers of Germany, from 1939 to 1945, deaths from these diseases plummeted. And if we adapt the plant-based nutrition of these countries and achieve the same low blood cholesterol, blood fat levels, that means that we also ought to be able to arrest that disease. And that was the basic thesis behind the research that I started back in 1985.
And I'm very excited about that research you've been doing because you have conducted the longest running study to show that heart disease is reversible through a healthy meatless diet, actually. And tell us more about that.
Well, back in 1985, after my wife and I had been eating a plant-based diet for a year and our cholesterols had plummeted, I went to our Department of Cardiology and said, look, I'm not interested in practicing cardiology, but I am interested in helping you take your patients with severe heart disease and see if we can't really reduce their level of blood fats and blood cholesterol. And they were enthusiastic, and I ended up with a group of about 24 patients who were so severely ill with this disease that a number of them had been advised to go home and get ready to die by these expert cardiologists.
So the patients that you had on this meatless diet, what were the results that they experienced?
Very exciting. Their angina began to disappear, that is their heart pain. They've lost weight. They not only felt better, but then after 5 years, we did the critical thing. We repeated a number of the angiograms, and we found striking results because when they were carefully measured and compared to the baseline angiograms, that is the outline of their arteries, before the program was started, and then 5 years into the program, we found dramatic reversals of the disease. And this was so terribly empowering to these patients because it made them really feel now they're on the right track. And therefore, they were not depending on a physician. They're not depending upon a cardiologist. They're not depending upon a cardiac surgeon. What they have been able to do, they have been able to unleash the incredible therapeutic powerhouse that resides within each and every one of us. But once again, if you're going to have these kinds of exciting results, it truly has to be strict attention to detail. And the phrase that I ask any patient that I'm going to counsel to totally give up before I will counsel them is, sweetheart, this little bit can't hurt.
So if we have a viewer today who may have heart disease, they may have atherosclerosis, high cholesterol, what things do they need to do? What kind of results can they experience on this meatless diet that you recommend?
If they are really absolutely dotting all the I's and crossing the T's, using a plant-based diet, and they know on a regular basis, every 2 weeks to every 6 weeks, that their total cholesterol is under 150 and their LDL, their bad cholesterol, is under 80, then they're absolutely they're right on the money for abolishing this disease. I will use an example. The young surgeon who replaced me as the chairman of the breast cancer task force in 1996, at age 44, with a cholesterol of 156, he had a heart attack after he had finished surgery one day and was writing post-operative orders, this crushing pain in his chest. And he had a heart attack, and his angiogram of his coronary arteries was actually quite good, except the lower part of the main artery in the front of the heart was completely diseased. And it was too long a segment for any of these common interventions, and he couldn't have a bypass, and he couldn't have an angioplasty. And he was very depressed. So my wife and I had him out to the house, and we counseled him. And at that point, I had 10 years of data. And I said, Joe, you know, you really ought to do this. You've been eating this toxic American diet. And he said, I'll do it, but I'm not going to take any of the cholesterol-lowering drugs with it. He became the absolute personification of commitment to this program. And within 2.5 years, when they did another angiogram, that diseased segment of his coronary artery was completely resolved. Disease was gone. And his life now is so solid and so empowered. He has absolutely zero fear of this disease now because he has made himself heart attack proof. Should people who don't have heart disease do this? When you look carefully at the battle casualties of Korea and Vietnam at an average age of 21 years in our GIs, at the time of their autopsy, if you look carefully at their coronary arteries without a microscope, 80% already have gross evidence of coronary artery disease. Now these people, these guys haven't been diagnosed with coronary artery disease, but they're already loaded with it. What's going to happen to them 20 or 30 years later? Why? And the most important thing we haven't even talked about tonight is the fact that at age 50, most Americans, if you look at their brain scan with MRIs, begin developing these little unidentified white spots that we now know are tiny little strokes. Why in the world would you say with somebody who doesn't have symptomatic coronary heart disease not to go on a plant-based diet and let these kind of little strokes begin to develop until your memory goes sour when you're in your 70s, then you lose your cognition? No, I don't think we can really escape that. Just because you may be somehow genetically gifted to get away without getting heart disease while you're eating the Western diet, there are so many other diseases that you are going to encounter if you continue to eat this way. And why do you want to have the opportunity to go into your senior years and not have that be when all your cognition and all of your intellect is absolutely right on the top? Why do you want to be somebody who has these severe personality changes, multiple strokes, in a rest home or nursing home? You want to be there enjoying your family, your children, your grandchildren, and ideally your great-great-grandchildren.